Good afternoon, everyone, and welcome to today's public board meeting. I'm the board chair, Linda Hughes, and we just have a short agenda this afternoon. I thought I would point out that the AHS board with this meeting marks the first half year of the boards. We're halfway through the year. It's been 6 months. And I just wanted to say I think we've come a long way in 6 months. Progress has been made on many fronts. And particularly the appointment of our new CEO. And Dr. Verna Yu is going to talk about some of the things we've accomplished over the last 6 months today. But before she does, I just wanted to say on behalf of the board, I want to commend Dr. Yu, the leadership team, and all the staff and physicians and volunteers at AHS for helping us sustain momentum towards building a vision and a sense of hard work and integrity within AHS. I think Albertans deserve a high-performing healthcare system that delivers safe, quality, patient and family-centered care. And I think the board feels we've made a lot of progress towards that in the last 6 months. There's still a lot of work ahead of us, but I think that we all feel at the board that there's a bright future and we've made a lot of progress. And with that, I want to hand it over to Dr. Verna Yu.
Great. Thanks very much, Linda. I'd like to thank the board and yourself, Linda, for your ongoing support and guidance over the past several months. We know that good governance is absolutely essential to driving change in an organization, especially one as large as Alberta Health Services. And the stable and constructive relationships that we have had, not only with the board, but also with the Ministry of Health, has really contributed significantly to the progress we've made over the past few months. As we enter the height of the summer, I just wanted to share with you some of the check marks that I think we've managed to complete on our to-do list. Earlier this year, AHS consulted our staff, physicians, volunteers, and stakeholders to select a new vision, Healthy Albertans, Healthy Communities Together, as well as refreshed set of core values. We believe that every large organization needs to have strong values from which it can build, grow, and be successful. Values are at the heart of what we stand for, and last month we landed on a refreshed core set of values. The first value that we identified is respect. Respect is identified because as a healthcare system charged with safeguarding the health of all Albertans, we value diversity, inspire trust, and treat others with respect and dignity. The second value is excellence. The value of excellence calls on each of us to strive to be our best and create the kinds of environments where learning is valued and where quality and innovation can thrive. The third value is accountability. Accountability speaks to our promise to conduct ourselves in ways that are honest, principled, and transparent, and show integrity by living our values and taking responsibility for our actions and results. The fourth value we identified is compassion. Through our value of compassion, we will show kindness and empathy for all in our care and for each other. And the final value, but one of the most important, is safety. Safety remained a value because we must place safety and quality improvement at the center of all our decisions. So these are the 5 values that represent who we are as an organization and as a people who care for Albertans. They will guide us in our behaviors and actions and help us to create the type of environment where we can give our full attention to patient and family-centered care. And to make these values easy to remember, they form an acronym called CARES, as in AHS cares, because we do. Last month, we also completed the rollout of our 4 foundational strategies with the launch of our people strategy and the information management, information technology strategy. Our people strategy aims to help our physicians, staff, and volunteers feel safe, healthy, and valued at work, and also to help them understand where we're going as an organization and how they can contribute. And the IMIT strategy is designed to give health providers and patients access to complete information at the point of care and to put data at the fingertips of researchers and healthcare leaders to inform their decision-making. Used in conjunction with the patient-first strategy and the clinical research, innovation, and analytics strategy, these 4 strategies will help AHS address pressures on the health system, coordinate current efforts, guide future directions, and optimize every patient encounter. Also this year, we've drafted our 2016-17 health plan and business plan, which has been approved by the board and is now under review by the ministry. So like Linda, I'm very pleased with the momentum that we've generated over the past few months, and it's essential that we sustain it. We'll do that by embedding and living our values, by operationalizing our foundational strategies, and by preparing for our new 3-year health and business plan in which we're going to drive improvements using the quadruple aim or balanced scorecard approach. That means that as an organization, we'll be equally focused on 4 areas of healthcare: clinical best practice and health outcomes, the patient experience, financial health and operational best practice, and our people. When we balance all 4 of these areas, we are doing the best we can for the patient and for the health system. And finally, I'd like to say a few words about our people. I've said it before, I think, when I first took on the interim position, and just to say that people are our greatest asset. Our staff, physicians, and volunteers care deeply about the people they serve, and they care about each other. They deliver or support the delivery of compassionate quality care, and they save lives each and every day. So I would like to thank them on behalf of all of us, not just as Albertans, but for their support, ideas, and energies that they provided to Alberta Health Services as we evolve into a high-performing learning healthcare organization. I remain very optimistic about the future of healthcare in Alberta because time and time again our people have shown their willingness and ability to rise to any challenge. I'd like to thank you for your attendance today and enjoy the afternoon.
Thank you very much. The chair was so excited about this meeting and hearing from Dr. Yu that I forgot to do the niceties of the meeting. So if we could just back up a little bit, all the members have seen the agenda. Any comments or any suggestions or revisions on the agenda? No, other than we'll change the order of them? Right, okay. Declaration of conflict of interest. Any conflict of interest? Hearing none. Approval of the minutes. You've all seen the minutes ahead of time. Glenda, second. Hugh, thank you very much. Now we could move to the Finance Committee report. David, do you have the report?
Thank you very much, Madam Chair. The Finance Committee met on June 13th, 2016 to review the Q4 2015-16 Performance Agreement Action Update and Performance Measures Update. The committee supported the submission of these updates by the board chair to the Minister of Health. In addition to the meeting report, I have been asked to report on certain amendments the board has been asked to approve regarding continuing care master services agreements. The board reviewed details regarding certain new master services agreements and amendments to the others. There are 16 affected agreements in total. Board approval for the new agreements and the amendments is required as each master services agreement has a total combined commitment value greater than $30 million annually or $90 million multi-year. The board wishes to approve the agreements and amendments and delegate signing authority for the contracted services with respect to such to the Alberta Health Services President and CEO. Accordingly, I move that Alberta Health Services Board A approve the continuing care master services agreements, the terms of which have been reviewed by the board with respect to the following providers: Hamlets at Red Deer Inc., Masterpiece Care Corporation, Points West Living Cochrane Inc., Points West Living Wetaskiwin Inc., and Silverado Seniors Village Partnership. And B, approve the amendments to the following master services agreements, the terms of which have been reviewed by the board with respect to the following providers: Aged Care Health Services Inc., Bethany Care Society, Chinese Christian Wing Kai Nursing Home Association, Christensen Communities Ltd., Covenant Care, Edmonton People in Need Shelter Society, Intercare Corporate Group Inc., Rosedale Partnership, Seniors Care Living Centers Ltd., Rivera Long-Term Care Inc., Excel Resources Society, and Shepherd's Care Foundation. And C, delegate signing authority on behalf of Alberta Health Services with respect to the above agreements and amendments to the Alberta Health Services President and Chief Executive Officer. I so move.
Thank you, David. Governance Committee, Hugh.
Thank you, Madam Chair. The Governance Committee last met on July 20th and discussed the mandate and roles document, the document that sets out the roles and relationships between Alberta Health Services, Alberta Health, and the Minister. We think we're getting very close to a final document, and we're hoping that a final version of the document will be ready for the September meeting. The committee also considered draft terms of reference for the board, board chair, board members, and all of the board committees, with the exception of the Quality and Safety Committee. That committee will be reviewing its draft terms of reference at its September meeting, and then, if once approved, sending it to governance to forward it to the board. Now, the board is to approve the terms of reference in accordance with the AHS amended general bylaws. The governance committee is recommending that the board approve the draft terms of reference, with the exception of the terms of reference for the board itself, as that will be approved at the same time as the terms of reference for the Quality and Safety Committee. So at this time, accordingly, I move that the Alberta Health Services Board, 1, approve the draft terms of reference as reviewed by the board, with such non-substantive changes that management of AHS considers necessary advisable, for the board chair, board member, Audit and Risk Committee, Finance Committee, Community Engagement Committee, the Governance Committee, and the Human Resources Committee, and 2, authorize and direct management of AHS to make such terms of reference available to the public through the AHS website. And I so move.
Seconder? All in favor? Carried. And with that, I move adjournment of the meeting. Thank you very much.